I specialize in diagnosing and treating gastrointestinal and HPV cancers. These cancers include cancers of esophagus, stomach, colon, rectum, pancreas, bile duct, gallbladder, liver, and some rare tumors such as gastrointestinal stromal tumor, neuroendocrine tumors, and retroperitoneal sarcomas. Though every cancer has different symptom profile, but you should watch out for symptoms such as weight loss, loss of appetite, any difficulty in swallowing, persistent altered bowel habits such as diarrhea, constipation, blood in the stool, any recurrent vomiting, blood in the vomiters, jaundice, abdominal bloating, abdominal swelling. Consult a specialist if symptoms persist. You should see a GI cancer specialist if you have been diagnosed with a GI cancer, if you have symptoms related to these conditions, if you have undergone a screening test and it shows some concerning findings, or if you have a family history of such cancers. The outcome of treatment of these cancers depend on the stage in which we diagnose them. If we diagnose them early, the outcomes are much better. That's why you should never ignore early warning signs. Treatment of these cancers depend on the stage in which we find them. If we find them early, usually they are treated with surgery. If we find them in advanced stage, then we treat them with other therapies such as chemotherapy, targeted treatment, immunotherapy. Treatment depends on the stage in which we diagnose them. If we diagnose them early when they're still localized, we treat them with surgery. We sometimes add radiation and chemotherapy before or after surgery to further enhance the outcomes. Yes, whenever possible, because these minimally invasive procedures such as laparoscopic and robotic surgeries enhance patient outcomes. They go home faster, they eat earlier, they are discharged earlier, they recover much better. Early detection is extremely important because if we diagnose these cancers early, we treat them much better and the outcomes are much better. As per the international guidelines, adults who are over 45 years of age should be screened for colorectal cancer regularly. In addition to these, patients who are at high risk of cancer, such as those with personal history of colon cancer, history of polyps, family history of cancer, irritable bowel disease, a lifestyle which puts them at risk of cancer, these patients should also go for routine checkups. To reduce risk, there are only few things which we can do, and it includes adopting a healthy lifestyle. When we talk about healthy lifestyle, it means we have to eat healthy, we have to exercise regularly, we should not smoke, we should not indulge in excessive drinking, and we should go for routine checkups. Cancer treatment is neither painful nor risky. With advancement of science, the treatment is now much more advanced and tailored to the patient which we are treating. So in a patient who is high risk for some treatment, with advancement in science, the cancer treatment is neither painful nor risky. The treatment is tailored to the stage of the disease and condition of the patient. The recovery from cancer depends on the type of cancer we are treating, the stage in which it is, and the surgical procedure we will adopt. If we are adopting a minimally invasive procedure, say laparoscopic or robotic surgery, the recovery is usually faster than the traditional open methods. Yes, every treatment plan is highly individualized. It depends on various factors. It depends on the disease which we are treating. It also depends on what stage we detect the disease in. It also depends on the fitness of the patient. And then there are various other markers which we use to personalize the treatment of each and every patient.